Hey folks, Dr. Eric Hughes here. In today's video, I'm going to be talking to you guys about feet. Feet. Why are we talking about feet? Well, let me tell you, because in my practice, in my naturopathic physical medicine practice, feet are one of the most important, one of the most foundational, literally foundational things to performance and to pain management. Not only reducing pain, but keeping it at bay, keeping it away. And I can sum that up within one question for you. When you go to the gym, how often do you say, okay, today's gonna be a feet day. I'm gonna work out my feet. Never. Never. I was going to wait, I just answered it for you. The answer is no. You're not going to do that, right? But why is it then when we go to the gym, if you're used to lifting weights, you got your back and bi days, you got your chest and tri days, you got your leg day, maybe even a cardio day, but we never have a foot day, right? You're working out all these muscles. Why aren't you working out the muscles of the feet? Speaking of which, did you know that you have five layers of muscles in your feet? That is insane. That's per foot, guys. You have 33 joints per foot, 26 bones per foot. That is insane. And we neglect that on a daily basis through shitty footwear, pardon my language, but really poor footwear, and just sedentary lifestyles, right? And we even wonder why sometimes we end up getting things like bunions, like end up getting things like hammer toes, foot pain, knee pain, back pain. It's all coming from our feet, right? Plantar fasciitis, it's all coming from our feet, folks. And it's not just the anatomy of it too, it's also the neurology component to our feet. We have something called the somatosensory cortex, right? Somatosensory sensation, how we interact and perceive and communicate with our environment. And if you're ever familiar with something called a homunculus, it's basically an illustration of this map of sensory receptors throughout our entire body. One of the largest areas in that map is going to be our feet. Let's take into account footwear. High heels, you kidding me? Right? The positions that we put our feet in, these straight jackets that we use on our feet, or even pointy dress shoes. Sometimes people use them every single day when they go to work. That's insane. And you're coming home and you're like, my feet are killing me. I don't know why. It might be your footwork. I mean, let's take into account even like the opposite of that. When someone says, this is the best shoe for your foot, it has like this crazy weird arch. It's got this crazy 3 inches of foam, right? It might feel like you're walking on a cloud. How much are you actually doing for your foot? How much are you actually doing for your body? Sure, it might feel comfortable on your foot, but it's like putting the dampener on your ability to interact and respond and communicate with your environment. If we aren't using our feet, those 5 layers, those 33 joints, those sensory receptors effectively, how is that going to play a role in again, performance, in pain? We can even think about neurological disorders that are degenerative, right? If we aren't using our feet, if we don't use it, we lose it. And that trying to keep our brain healthy, all that neurology, it works 2 ways, right? We use the feet as a floodgate of receptors of sensory information from our body into our brain to keep our brain healthy. I am going to end the video here, mainly because now you guys have a lot to think about, right, with your feet and how often you're using them on a daily basis. In the next video, I'm going to talk to you about how you can improve your feet, how you can take care of your feet. Okay, guys? Once again, my name is Dr. Eric Hughes, and I'll catch you guys next time.